Okay. Good morning from Asia Society Hong Kong. I'm Executive Director Alice Mong, and this is episode 40 of COVID-19 Update. We started the series in February of 2020, a few weeks after first case of COVID appeared here in Hong Kong. And today I wanted to give you a bit of an update about what's happening in Hong Kong and then dive into our discussion with Dr. Melissa Giglio, today we're going to talk about mental health in children. And, it's something that I've been looking forward to. And ever since I read an interview with Dr. Melissa Giglio in February in SCMP. So we're delighted that Dr. Giglio can be with us. But today's headline is about 558 cases here in Hong Kong overnight. And but there has been a kind of a club cluster that happened here from Lan Kwai Fong, because since the government opened the venues, the bars, in about two or 3 weeks ago, not surprisingly, there has been some cases, cluster of the clubs. But interestingly, also schools, as school also resumed in April, and about total of 94 cases involving 61 students, 33 teachers, from 87 schools. So it's actually not a Department of Education. The government is not worried that there is a kind of cluster from schools. So these are cases individually. But some international school, one in particular, is closing for just thorough cleaning for a day or two. So it's nothing to be alarmed about, but it is something that we're seeing. The government is assuring us there's not a sixth wave happening. Maybe we're coming out at tail end of the fifth wave, but to be continued. So today, as I've mentioned before, we're really delighted. We're going to focus on the children and mental health. And Melissa is somebody who is really kind of quite well known here in some ways. I've been reading a lot about her interviews and some of the stuff that she's been covering. So I'm really delighted that we can have her with us. She's a clinical psychologist and is a director of Central Health Partners child development team, and she's a trained therapist with over 15 years of experiences specializing in treatment of childhood disorders. And she also deals with ODD, oppositional defiant disorder, ADHD, attention deficit hyperactivity disorder, and that's something we can also talk about a little bit after as we get started on the program. So I'm going to hand it over to Melissa to kind of get us started, setting the stage on what she has seen this last 2 years and 2+ years, and then we'll continue the conversation. And please, those of you who have questions, please send it via Slido. We already have some great questions from the audience, and so Melissa, over to you.
Great. Thank you. Thank you so much for having me. So over the past 2.5 years, we have seen a massive increase in anxiety and depression, and it really extends across ages. So we're talking from preschool to early elementary, all the way up through early adult. Really, the extended periods of time at home when schools were closed and the social isolation probably had the greatest impact on the kids in terms of them not being able to go out, them not being able to see their friends, just overall depression from just being restricted. And then the stress of also having to be trying to learn on Zoom, participating in class. We just saw this downward trend in terms of motivation and engagement. And I think in terms of the family stress, that really, the parents are already stressed out, they're home, they're trying to work. And then on top of that, they're trying to support their children who just want to be kids. It's so important for their development to be around same age peers. And we really have limited that in Hong Kong for extended periods of time. And that's really kind of what we've been seeing a lot of in there. In addition to that, though, we see a lot of behavioral problems surfacing from the kids being home and just testing limits, them feeling frustrated and not knowing how to regulate their emotions. Again, you're at home, you're stressed out as a parent, you're also trying to have this work hat on, and your kid is just not able to communicate how they're feeling, what they're thinking, and clearly articulate what they need. So it's just caused a lot of kind of difficulties within the household. There's been a lot of social difficulties. We've seen some academic difficulties in terms of, just being behind, unable to catch up, and then difficulty motivating to get back into that school mode too. So we're just overall, we've seen great impacts, and hopefully a lot of people are trying to seek support when they can. But even that's been somewhat limited, especially with this last fifth wave, because so many clinics, they were still maybe doing sessions on Zoom, but a lot of the clinics closed their in-person sessions, which we were really able to maintain for the majority of the pandemic, which I think was really helpful. I think this last wave hit really hard. And then also this last wave, a lot of people left Hong Kong, so they didn't have the closure that children needed to say goodbye to friends, or to say goodbye to their home that they might have lived in their whole life. So there's been a lot going on. And I feel like Hong Kong, because we've been so closed off to the rest of the world, we're probably feeling it a bit more than other places that have kind of accepted that this is something that we have to live with, that we have to adapt to, that we need to do our best to protect ourselves, but that it's, like the flu, and that it's going to continue to be here. And the issue is how much do we let it impact our lives and disrupt our lives? How do we learn to coexist with it, and just be as safe as possible, but still have what we need as human beings, which is that social connectedness and engagement.
I think you touch upon a lot of points here, and one of them I wanted to kind of also ask you in this, in the beginning when we started this episode, this series. I think all of us thought it was going to be like SARS, a couple of months, and never really expected to be 2+ years. So in the beginning, how did you cope? I think many of us saw this as a short-term issue in terms of handling it. But then, as the progression, in 2 years, how have you seen have to adjust your practice, advising the kids, parents, family, and all that? How have that changed in the course of the 2 years?
I feel like what we've learned is, because we've seen such changes in behavior, and we can anticipate when schools close that we're going to see this change of children having to accept that they're all of a sudden limited and their life is limited, to then transitioning back to school. We see this also influx in behavior with overexcitement, kind of forgetting how to behave appropriately in certain environments, how to behave in school, how to, not just be too much, be too aggressive, too assertive, and how to just relate again. So we're really kind of, I feel like it's almost like a war zone mentality of like, okay, we're going back to school now throw them into activities again, throw them into play dates if you feel comfortable, take them out, kind of soaking up as much as we can until we wait for like the next, warning where we all have to go hide again. So it's felt that's what we've had to kind of do. But for parents, it's hard because, we've been so worried in Hong Kong, the consequence of what happens should you get COVID. Until this fifth wave, it was very scary if you had COVID. The risk of fear of what might happen if you're separated from your child was a real one, even though it didn't happen there weren't many cases of it. That, I think, was probably the biggest fear. And just imagine that anxiety as a parent and passing that on to your child, who hopefully was pretty unaware that might have been something that could have happened. But I think that limited parents from really diving back into socializing again, or really seeing the value of those play dates that the kids used to have all the time. They used to just run into people and see people and go play with them. They used to be, Hong Kong is known for having their kids oversubscribed to classes, but there's a social aspect to those classes too. They're only an hour, but it's kids playing together and getting that activity level that they need. And I think before the fifth wave, people were all back into those activities again, because we had a good run where
Right.
the cases were really low. And I think we all kind of could take a breath. Like, we knew what could happen should you get it, but there was a low incidence rate. And then when that fifth wave came, it almost felt like that was the hardest one that surfaced, because we just didn't expect it to blow up the way that it did. And people really isolated themselves probably more than ever. And then that's when all those sudden changes really started to happen. So that's kind of the mentality is we've had to kind of help parents feel comfortable with that discomfort of having their children socialize when they could, knowing that the other shoe is going to drop at some point and we were going to have to revert back again and they weren't going to be able to do it.
I think you had a good point. I mean, in fact, I call the fifth wave. I felt fifth wave for us was more like a tsunami because we were so calm. I mean, Hong Kong did so well, for the almost 2 years, and I think we were the safest. Everybody wore a mask, and even though we were confined, I think people felt safe. But when the fifth wave hit, many of the I think some of the policies about quarantine, Penny's Bay became a really something that everybody was terrified of, especially families. And right now, I want to let the audience know a lot of it right now talking about some of them are the expatriate families here in Hong Kong, and we've had the discussion too also about some of the issue faced by all parents were really afraid at that time of separation from their kids because the government because a lack of hospital beds could not let a sick child parents cannot be with a sick child. So I think that separation anxiety made headlines, and a lot of I know personally a lot of friends left, especially those with young children, whether temporarily or permanently. And you yourself are speaking with us from the United States. So how that anxiety, I mean, that came all of a sudden. So that must also have an impact on the entire family because they had to be really plucked out. I mean, literally overnight. Um, uh, Leave their comfortable homes. And how do you help address that kind of anxiety and get children, get a family prepared for that disruption? And the disruption continues.
Yes.
I understand it because right now, even when the kids or the family returns, their friends are not going to be there. Many of them have decided not to come back to Hong Kong permanently. So how do you now? I mean, we're still kind of in the middle of it because I've right now school holidays. Some of the people are here. Some of them are getting ready to leave again. So that kind of disruption is something we've never seen before. So how do you, as a parent yourself, and also as a professional, how do you now address those kind of continue uncertainty, these ripples from this tsunami of the fifth wave?
Yeah, I think the leaving this time, like for us, the reason we left is that, all of a sudden we were all isolated at home for 3 weeks. My children hadn't left the house and I have 3 kids. And I was working from home, like no one was going to the clinic, no one really felt comfortable. And it just came to that point where I thought our goal was to go home for the summer. We hadn't been home in 2.5 years. And we were just decided we might as well just go now if we're all just going to be isolated in our house for an indefinite amount of time. And the mandatory testing was coming up, which kind of made us a bit uncomfortable for the kids because they had just been vaccinated, but there's a lot of questions. So that's why we left. But how, to deal with the possibility, they didn't get to say goodbye to any of their friends in their that they grew up with. And I think that was a conversation about why that was. And being able to have those goodbyes either via Zoom or, some way to feel connected or when you're going to see special families again, like close friends. But also then explaining, that other people might be moving on to new places. And then questions are then related to, well, why are we staying here? Why are we coming back? And I think families are really wrestling with that. I think we have families who are dealing with their kids being very upset that they're leaving Hong Kong permanently because it is such a wonderful place. It is beautiful. We all live here for a reason. And then the families who are staying, your friends do leave. That's the thing about Hong Kong is if, it is a transient place at times, but I feel like a lot of families spend much longer than they anticipate here because it's so wonderful. So it seems just the magnitude of loss is going to be really different. So I think it's talking to them about they're going to make new friends and there's going to be new kids in the school and it's still going to be very familiar and all the things that kind of help them feel comfortable about home in Hong Kong being their home are still going to be there. It's just the players are going to be a bit different too. So as much as we can help support them in their social development and developing those new friendships too. Probably the same for adults too. Many of us have lost our close friends. We call them our, as an expat, our family. So our friends who are like family. So it's a matter of us adjusting as well. So we really need to make that effort because our kids do need those relationships. They do need those play dates. They do need to have birthday parties again, and go to games where they lose or they win, because it's part of how they develop and how they grow in a healthy way.
And I think one of the in February you were interview an SCMP, and one of the points also I feel like we need to wanted to kind of address about also parents needing to really take care of themselves so that they can also take care of their kids. Because as you mentioned, many of the parents, for about almost 3 months, because of the fifth wave, were working from home. And also in Hong Kong, spaces are not as spacious as in the West, and the anxiety of having a whole family there. Hong Kong's, even Hong Kong families, especially if you're living in a 500 square feet house with kids, a spouse, and also a helper there. It's like on top of each other. So you mentioned the importance of kind of like me time for parents also, so that they can take care of, especially mothers, and we take care of the whole entire household. So if you can kind of address some of that issue there.
Yes, definitely. I think, in the beginning of the pandemic, I feel like we were so, unsure about what was going to happen. And we were so focused on how we were going to adjust, what the plans were, what's happening to the children. We didn't really take, notice of parents' mental health and the strain of, having to work from home, having to manage their career, having to wear this hat of being, the teacher, the supporter, trying to figure out how to get their child to sit down and engage. I think it highlighted to parents a lot of their children's behavior in school that they probably didn't know about and didn't see. And also our expectations as parents, since we're not educators, is we expect more of our kids, not realizing it's typical for kids to be off task or to take lots of breaks or to be fiddling with things. But even I, as a psychologist, you see them distracted, and it can be very triggering for a parent to be like, "You're supposed to be paying attention." But there wasn't a lot of focus on that. Checking in with yourself, checking in why you're feeling frustrated, and are there things that you can do, and how do you prioritize that time and value it so that you can be a better caregiver, so that you can be a better mother, so that you can be a more understanding spouse, that you can feed off your partner if they're having a stressful day, and what you can do. So I feel like as time went on, we started to notice that parents were really feeling increased anxiety and depression, and their need was just as great to kind of really prioritize their mental health and their overall well-being, be it exercise, taking the guilt away,
Right.
meditating. I think that was one of the things that probably we were so worried about our family and how we were going to function. We didn't prioritize that. If you're not a healthy caregiver, healthy yourself, how are you going to be the best caregiver for everybody else if you're just exhausted and you have nothing left to give at that point?
Yeah, I think your point about taking the guilt away is really important. I think sometimes I have to say I feel very guilty sometimes because I have no kids. I'm single, but when I see my friends who are struggling, I mean, not. I think we're trying to be as helpful as friends and then as also as bosses. But I myself seeing my colleagues, especially the one with kids, having to deal with it initially, and I think we have to be lenient. I mean, certainly. I think if nothing else from this exercise is working from home, the technology. I lost several staff in the beginning because, they're mothers and kids are starting. One staff was, her son was starting, she had two boys, one in first grade and one in second grade. And she said there was no way she could deal with homeschooling as a mother, even though she had help because the stress of, like you said, you're so right about we're not educators. And I think one thing we do appreciate after this is many of the parents appreciate how much school and teachers are there. We take it for granted during normal time, but it's when you have to be a teacher yourself to the kids, realize the importance of the work they do. So I think one of the things I guess I wanted to address is how do you see that, as a psychologist, signs of when you think your kids or young people, and I think there are different age groups. I think I understand your kids are under 10, but then you also have teenagers right now. So how do you spot the signs and so that you can, start helping them. Or sometimes they don't want to help. I mean, I know a lot of friends with kids with teenagers at that age. Last thing they want is the family meddling in there, but they're the one sometimes needs the help. Also, the stress of schools here in Hong Kong, testing and all of that. So how do you spot the signs?
So I think the signs we look for with children, like younger kids, are just changes in behavior, kind of, feeling more easily triggered and more irritable, sleep disruptions, waking up in the middle of the night when they used to. And this can really stem from when they're very little to like 9 or 10 because they're feeling really stressed, settling down to sleep. So oftentimes children with anxiety will kind of have to unload before they go to sleep, and they'll kind of delay bedtime for that reason. So those downloading times tend to take longer than they did before when it was just kind of a check-in. They're having trouble finding something positive to reflect on throughout the day. When school goes back, typically we see this reluctance to even go back to school, even though they seem excited. They initially were excited, but the act of actually going back to school and the anxiety about entering the environment again, having to be there all day, they kind of forget how long the school day is. And then, the limitations in the classroom, you're only allowed to sit next to one person and there's, a plastic screen between you and you're not supposed to turn behind you to talk to your friend. It's a lot for little kids who are just used to being just more just free and fluid in their day. They are allowed to roam around the room. So the signs are really those kind of changes in behavior and acting out and regressing sometimes. For teenagers, it's really about kind of closing themselves off and distancing themselves more than they did previously. What we found is, children were reaching out via video games and social media, but we do know the negative impacts of social media with extended use. So if you see them kind of diving into their computer, locking themselves in their room more, attached to their phone where it's in their face every second and you can't kind of detach it. And then these kind of blow-ups about the risk of being unplugged, that's when you can kind of say there's some signs going on there that they're struggling and they're having trouble with in real life kind of interactions too. I think the stress of the exams, we saw really this difficulty of kind of, using their executive functioning skills, being organized, being able to sit down and review and revise and have a positive mindset about these exams, because so much of it felt like they were doing it on their own, isolated at home, where being able to study in a group and bouncing ideas off of each other, that's a really good way for a lot of people to learn. So I think seeing that reluctance and kind of catching it as early as possible to help them shift their mindset and know that there is an end result here. You're going to take the test. And then after that, what do you have to look forward to? How can we take some of this pressure off of them? I feel like these kids have just been under enormous pressure. They've had to deal with enormous transitions and they've done very well overall, but it's a lot for anyway. It's a lot for adults. Of course, it's going to be a lot on children, especially it's going to be hard on teens when we know that, your friend group is so important for your development as an adolescent, more so their opinions and your interaction with them than even your parents as an adolescent. That's how important your social group is. And to not have that, we're really stunting their social development by limiting them having access to people, which is really hard to hear, but we need to see the value in those social interactions with others. We need to know how important it is for these kids to just have a healthy understanding of how they function in the world, how they navigate social relationships, how they navigate conflict. These are all really important things.
And you also mentioned, I think in one of your interviews, the importance of getting the vitamin D, getting the kids out there. You said, I mean, and I think I seen it in last year when I was home visiting in the States and seeing my own niece who's 8. It's just that the importance of, they're learning online, they're playing a video game or, games online, and they're learning piano online. Everything is online almost, but it just getting them out there. And there are ways of getting them out there in a safe environment, going for a walk, whatever. And if museums are open or doing whatever to get them out there. So kind of talk about the importance of just getting them out and exercise. That was one of the complaints I heard from one of my friends. Yeah. Again, boys sitting at home, and she was really frustrated that the kids were gaining weight, and kind of the outdoor, the vitamin D prescription, I guess.
Absolutely. So, I mean, we know that vitamin D is one of the things that really protects us from illness in general, and
Right.
especially COVID-19. And we know that everyone pretty much in the world is pretty deficient on vitamin D because we're never outside enough, but it is
Correct.
so important. Um, the good thing we have in Hong Kong, even when we had restrictions until they were kind of at the worst, is you could always go for a hike. You could always go for a walk, even if the mask was on. And it really was just kind of building that into the day because they need to move, they need to detach from the screen. The difficulty with kids, though, is they had class on the screen. They love to look at the screen to play games and to watch shows and do multiple things. So it was really hard for them to shift from my learning and not understand why they couldn't just go to the thing they prefer to. The problem is you see this irritability in them from being kind of this Zoom fatigue from being plugged in for too long, where having the separation, having it built into the day as a schedule, like let's go, bounce a basketball outside on the sidewalk. Like it doesn't have to be anything huge, but just getting away and moving their body. Should we run laps up and down the hallway 10 times? Can we do it faster? Making it fun games where their movement is just involved. The schools tried their best to incorporate that throughout the day with these brain breaks, but during the big breaks that kids had, making that part of their constant routine can really reset their entire mood and their attitude and help them sustain attention for longer. We also know that exercise can help, kind of modulate people's anxiety because it helps you get out some of that excess energy, and it can help you focus on your breathing. It can help you focus on your form, which then helps kind of with a grounding kind of technique where they're really resetting themselves a bit so they're not feeling quite as stressed and overloaded, because when you're so stressed and overloaded, you're not really that productive also, which is, so it becomes this vicious cycle. So to be able to, again, take that time to say, I'm going to go for a quick jog for 15 minutes, it really helps them sit back down and re-engage in a better, fresher way. So I think that was the one thing that we really were trying to emphasize to families. We had a lot of reluctance from the kids, but once we really made it part of their mandatory schedule, we saw that the reluctance diminished really quickly if it was in there. And we also said, you know what, we know you want to have some fun on the screen. That can be permitted, because that's the one thing that was kind of confusing for a kid. You're making me sit here all day, but I don't get to do anything I want to do on here. To give them a bit of that time. And that's where I think parents became much more flexible, because we all try to follow the guidelines and try not to give our kids screens, except on special occasions. But we had to become more flexible in that, just because we had to get buy-in for them following our directions, to do those movement breaks, to participate in class on Zoom, to be engaged.
I think now I want to kind of address, I know we have a lot of questions coming up, but I have one last question before we go to Slido to get the question from the audience, is policy. As a professional, mental health professional, it's dealing with kids. One of the things that I saw during this semi-lockdown here in Hong Kong for this last 3 months is when I walk by the playgrounds, the government playground. Hong Kong has some wonderful, but everything was wrapped up in, do not touch. I mean, the government literally shuts down. The public pools were shut down. The playgrounds were shut down, and we had several holidays, long holidays, and also school was closed. Yeah. They brought the summer break up in March, but it was like this playground. You want to get the kids out there to play, but the playgrounds were shut down. So I guess the question I want to ask you is like advice to policymakers, to people who are running. I think sometimes I feel like they're looking at short-term solution, but the long-term issue of kids, the mental health. I mean, what happens now can impact them in a long term. But what are some of the advice that you would give to the policymakers in terms of addressing some of these issues? Is it necessary to really shut the playground down, or is there a safer way for the kids to play in the playground without shutting it down? I guess that, that's something that I wanted to ask you about.
I think shutting down, I understand the gyms, and I understand even limiting us going out to dinners and things like that. I feel like those were, things that we enjoyed, but they're not really necessary. But the kids being able to attend school, and the kids being able to play in outdoor equipment, and being able to go to the beach or go for walks and hikes, those are the things that should really be protected and prioritized. Kids aren't the highest risk. They never have been for COVID-19, and they are the ones who probably need the exercise and the interaction the most. So, keeping those open is going to be extremely important to reduce anxiety, depression long term. It's going to reduce probably obesity and coordination difficulties, motor difficulties. Children are going to have a lot of trouble writing exams if they haven't been able to play at a playground and climb monkey bars. These are all play is so critical for development, all development for kids, that to take that away, we're seeing that kids are really behind. Not only are they behind just being able to sit in a chair for long periods of time, they're behind on things like being able to tie their shoes independently, being able to organize themselves to perform independent tasks, like going to shower, brush their teeth, going through routines, because they haven't had a lot of practice by playing and running around, and being able to climb on things, jump on things, swing. These are all very important for kids, and they do serve a function for them to learn how to organize themselves, them to learn how to regulate their neurological system, for them to be able to tolerate, even if they fall down, how they recover, how they really bounce back and show their resilience. So we should be prioritizing children's mental health, children's play, and children's education, because the long-term effects of that, kids exhibiting anxiety and depression at young ages, it doesn't just go away. And we already had a high incidence rate of anxiety and depression before COVID. Typically, it was 33% of adolescents had anxiety and depression, clinical anxiety and depression in adolescence. So now imagine with COVID, we have kids who are showing these signs of anxiety and depression at a much younger age due to the stress and isolation. That number is going to be significantly higher by the time they're teens. And they're not going to have the skills, or we're not going to have enough support to help these kids. It's going to be a long-term impact if we don't focus our attention on the kids being healthy. And that's actually going to help everyone else feel less stressed as well. Because kids who are depressed and anxious are high risk for suicide. They're at higher risk for conduct issues, which means criminal behavior. It means substance abuse. It means not graduating from school, possibly deviant behavior. And there's just a greater risk for them. So we should be prioritizing it and valuing it as a way to protect them in the long term, rather than just worrying about the short-term safety.
Right. I think that is, as we're talking here, Hong Kong, July 1st, we'll have a new chief executive, and I believe the health sector has not been named yet. But I do hope that Hong Kong, it's not just Hong Kong. I think everywhere, the mental health, I kind of have always felt in light of the COVID has been this silent pandemic, in that the doctors were talking about vaccine, we're talking about the disease, the COVID itself, but behind it, whether it's in the U.S., anywhere in the world, I think the mental health, whether it's for adults or children, I think is going to be something that we need to address. And I hope it's not kind of on the sidebar. It is, like you said, I think it needs to be prioritized. But one other question, and we're looking at a question from the audience now, which is, this one is really interesting. It says, what can be done in helping children from disadvantaged backgrounds whose mental health has been disproportionately affected by the pandemic?
What can we do to help them? That's a good question. So I would say going to anything you can that's available that is low cost or free. So playgrounds, going to museums, going to parks. There are lots of different things around Hong Kong that can be really helpful for them to have access to being outside and playing and getting out of the small space they may live in, or even the shared space. So it's really just kind of getting them out and around others. In terms of if there's some real mental health issues, there are some great organizations that do offer services for free or discounted rates as well for the kids who really need that additional support. Even if it's hard for kids to get somewhere, some of these sessions are available via Zoom, because we know that there's, not just the people who can afford to go to therapy need therapy. We know that, most people would benefit from therapy, but there's some people who really need it for a short period of time, just as a reset, just to have someone to talk to, just to have someone to teach them a few skills and strategies, so that they're able to then problem solve and apply it in their life. They've been through a lot. We all have, but I think the disadvantaged children in particular have probably suffered the most because they were the most isolated with the least amount of resources. So making sure that you are taking them out, doing the things that you can that are low cost or free, hiking, going to the beach, going to explore different little islands, being able just to explore this fabulous city. Those will all be good things, even if they're kicking and screaming. And I'll be honest, very rarely do I ever meet a child who's super excited to go for a hike, regardless of how fit the family is. They always feel good when it's over. Like, even if they're moaning the whole time, there's something about moving your body and exercise that no matter how hard it was, there is a sense of accomplishment when it's done. So just know that that's not unusual, and know that the long-term benefits of it outweigh the complaining and getting them there initially.
You also mentioned, one of the things that in my reading on, kind of the difference between Hong Kong and having grown up in the U.S., the importance of counselors. I know in high school, sure, the academic counselor advising you what subject, and just being, I think even here in talking to some of the local schools, the importance of counseling, high school counselors or whatever. So is that something that you're aware of? I kind of get the sense that maybe the local schools here, although they have counselors, there is not as long term. I think in our episode, a few episode back with Professor Vivian Sung, Sui Yan College, she was saying, counseling, many of them, are not there for the long run, as much as they want to make it a career. And whereas I think in the West, the profession of counseling is quite, you can have a long-term career. High school, almost every high school have, especially now, unfortunately, within the U.S. with the gun violence, counselors are at every schools and all of that. So kind of maybe you have some idea, aware of the counseling they're not doctors, of course, but being there and helping disadvantaged or just kids in school.
So counselors can have a massive impact in schools just because they're on the ground there. So they kind of see everything that's happening. And they are very well trained. They go through advanced degrees or certificates to be able to work with special ages that they specialize in. Usually there's an age range. The issue with counselors, though, the difficulty for them is that there's usually one of them and a very large amount of children who are available. When we do have counselors that stay with a place for a long time, right, they get to know many of the children and they see them develop over time. What's great about those counselors is they're able to notice little changes in children, right, so they can pick up when additional support is needed. And when you keep having new people enter, it takes time to kind of, number one, understand the role of the job in that new place, but two, get to know the community. But they can be fabulous advocates. Counseling in general in schools, though, is short-term. It's usually about 6 sessions, 6 weeks is where they can do short-term intervention. And then there's usually a decision whether they can refer out or not. Sometimes they're able to refer out sooner than that, and they still can provide some check-in support. So they can be a great part of the team. They're great to communicate with families and for teachers to go to express their concerns about kids. I feel like they're wonderful at sounding the alarm that something is going on. And it doesn't always have to be a crisis, which I think is great. It can just be noticing a shift in behavior or just noticing it, just a change overall in their affect, seeming a bit more withdrawn or depressed or kind of having some more difficulties. And this is true even in the US and the schools. They always look to the counselors for any of the troubled kids who commit some of these horrible acts, because none of those kids haven't been on their radar. They have been. It's just a matter of what happened after. were the recommendations followed through? Did they go through protective procedures to ensure the safety? Here in Hong Kong, we obviously, thankfully, don't have that fear, but we do have a lot of kids who are going to be probably exhibiting some suicidal ideation, feeling more hopeless and helpless, especially as, exams come and, the expectations are very high. We had a fairly high rate prior to COVID, and now we've had children who've learned in a very atypical way with the same set of exams. So we can imagine the stress is probably even greater. Counselors just doing those check-ins. There's schools who do well-being check-ins. They'll do them either weekly or bi-weekly. And all that really does is give counselors a chance to kind of take a pulse on the school, on their grade, to see how everyone's doing. And what's great about that is they might even be able to track with longitudinal data changes in mood and behavior over time, to then signal them that who's my priority that I need to be checking in with now, based on what this child is saying and reporting. There are a lot of schools have more resources than others, but counselors can be one of the greatest resources that a school can have. And as schools should really be prioritizing having counselors, as many as they can afford on campus, because they really can be the front line to helping the school just have a positive wellness overall. Having this growth mindset has been a massive push. They put a lot of that on teachers in some of the schools, but it's really nice to have someone who's leading it, who's kind of an expert in, children's mental health.
Great. And I couldn't agree with you more. I think right now, and that's a wonderful opportunity for a lot of young people who want to train. I think they go, what else? I mean, counseling can lead to studying psychology and medical, being a psychologist and so on. But it's just that right now, I think there is opportunity there to explore, again, advice to policymakers. This next question is from a parent. How can parents better support their children, especially with the pressure of school exam resuming in the summer on top of all of this, the COVID?
That's a good question. So spending time with your kids, not talking about academics, not talking about exams and how they're doing, but just being with them. Giving permission to have a movie night where you're just sitting around watching something that they want to watch, having that time where you're just able to be close. The thing with older kids in exams is they don't always want to be touched by their parents anymore. So seeking any opportunity you can have where it's a positive interaction, and it doesn't have to always be this face-to-face conversation, which teens typically don't like. They do much better in these parallel, than they're kind of side-by-side conversations. Car rides, taxi rides are a good time to check in. They're kind of trapped with you. But it's a nice time just to, really find things that you can praise them for, things that you're noticing, really checking in as a parent, am I being critical at all? Because they usually criticize themselves enough. They know your expectations. They've heard you. They know what's important. They know what's important to them. What kids don't hear a ton of, though, from their parents is appreciation for their hard work, appreciation for their effort, validating this has been really hard and you've done a fabulous job of trying to manage this. This is a lot for anyone, especially someone your age. I'm really proud of how you're pushing through this and how hard you're working. Even just saying those words can sometimes be the motivation a kid needs to say, I can do this now. I feel like someone believes in me. And now I know I can sit down to do this for myself. It's so much better than kind of being on top of them to study and criticizing them and just adding to the weight that's already on their shoulders. So for parents, it's really just connecting as much as possible and just letting them know that they're there, that you're there for them and that you believe in them and that you're going to love them regardless. At the end of the day, we want our kids to be happy, and there isn't any culture that kind of says anything else. Like that's usually the first thing that everyone says, more than I want them to be successful. I want them to be highly educated. We of course all want that for our kids. But the most important is we want our kids to be happy. And if you're happy, everything else can usually work out. So if we focus on that and in trying to find something to be happy about daily, something to appreciate, it can really make a massive difference in everyone's outlook.
But I think you have an interesting point here. I think sometimes I see parents, when I was your age, I did this and that. I mean, that has always been something that I hear a lot from friends and so on. And I think they want what's best for the kids, but at the same time, I think kids these days are so much smarter. I mean, they have access to information, online or whatever. But emotionally, they're still kids, right? I mean, so knowledge wise, I kind of get the sense it's the wisdom, or it's that kind of how to teach them to be people, human. The human aspect of it, I think, is something that having interns here, having worked with young people, I feel they are still craving that. They may not come out and say it, but they still need that part of it. I think is something that sometimes parents or mentors or adults or teachers could help provide. Knowledge, I think they have. In some ways, I find they're so much smarter than I ever was. But I think when it comes to emotional development, I think that's a trend I've seen anyway in this 20 years of working with, especially when we've had young interns. So it's something that I think parents should, great advice from you. But this is another one from parents, is that what is a fun and interesting way for me to breach the topic of mental health to my kids?
Great question. So we talk about modeling a lot in therapy and with family therapy, and to really talk about your difficulties, and but also talk about what you do for mental health and why it's important. Oh, I had such a stressful day. I think if I'm going to take a few deep breaths, or I'm going to lie down on the couch and really focus on what's happening in my body to recenter myself. And oh, I feel so much calmer now. This really helped me think about the situation in a different way. So kind of modeling those strategies for their children and normalizing, this made me feel frustrated. I was really angry when, or, oh, I just got really upset, and, I could have handled that a different way. And how do I go about it? That's going to be modeling for children how to do that. And it's also going to be normalizing the fact that it is okay to feel upset. It is okay to feel sad. It is okay to feel frustrated. What we want to work on for kids is, how do we manage frustration and push through it and persevere? How do we, and not be negative? How do we get over that hump? And talking about ways that parents do that, real life examples of, frustrations they might feel at work, or even amongst their family, and then problem solving out loud so they can hear that, can be really helpful, to talk about the importance of that wellness, or even say, it was so helpful that I could talk to you about this, even if the kids aren't talking, they're just listening. But just even saying that, you're opening the door to say, if ever you have something that's weighing heavy on your mind, it just like it was helpful for me, I can be helpful to you, without saying, come talk to me if you ever have a problem. It just makes it harder for the kid to want to do that. So just thinking about, our goal is to have this positive relationship where we want our kids to come to us in good times and when they're struggling. But we have to show them both sides of that too. We're not these perfect people who have everything together. Kids think we have it all sorted a lot of the time. The truth is we don't. We've had to adjust too. So letting them know about that, letting them know that, you've missed seeing your friends, can bring up that conversation for them. Say, I've really missed seeing my friends too, or I really miss whoever left. Okay, we could think of some things that we can do. We could write them a letter, we could FaceTime them, we could schedule a time to have a call with them maybe later. What would you like to do? What would you do with them? Oh, I have a great idea. We can go do that, just us two. We can think of ways to help them problem solve so they're not feeling stuck, which I think is really helpful for kids.
I think one of the things I wanted to kind of address or ask you about is really here in Hong Kong, and Asian culture. I don't know which is Hong Kong or even China. I see the suicide rates here in Hong Kong among teens have been unfortunately quite high, and I think I'm quoting also a Kelly support group survey finds 60% of young people do not seek help when they feel stressed, especially the one between ages of, I think they did a survey of young people between 14 and 24. And some of the problems we're seeing in the news, not major, some of it is, I think, the suicide rates and so on. So here in Asia, in Hong Kong in particular, the stigmatization of like seeking, if you were seeking support to go see a psychologist or psychiatrist, you're crazy. I mean, that stigmatization by society is quite prevalent. So how do you kind of change that? I think in the West, I mean, as seeing a psychologist nowadays, it's in some ways, if nothing else, with COVID, I find that it's okay for us to talk about mental health issues because we're all going through it. I mean, it's a global a problem. None of us is it might have been, temporarily we could have addressed this, but 2.5 years, we're all going crazy to a certain extent. But here, how do we now, I think with some of the Asian society, I see it also maybe in China as well as Hong Kong and Taiwan, where I think the stigmatization of seeking help from outsiders and, professional help, and also the profession itself, maybe there's not as many psychologists, yes, where people are not studying. A lot of medical doctors, I mean, all our parents want us to be doctors and so on, but psychologists that feel, I think taking care of the mind is just as important as your physical health. But how do you kind of address that? I mean, the stigmatization in Eastern societies. I'm talking in generality, but I think this is my own observation.
So that stigma's been around forever. And I feel like there has been some movement. I will definitely say in more progressive kind of cities like Hong Kong, we are seeing that there is progress towards understanding that, going to seek support from someone, naming it as a disorder, I find to be the stigma more than anything else, rather than the symptom. And I think that's kind of what has made a lot of Asian people kind of more comfortable with the idea of therapy, is that you're kind of addressing an issue almost like a coach or a tutor. There isn't an issue with seeking tutoring help if you need it. I think all in terms of their understanding is seeing therapy as a kind of a way of coaching. And it can be. I mean, we're teaching strategies, we're teaching them skill building, where you're working on areas of weakness and trying to help them build up in those areas. And we're also focusing on what they do well and strengthening in those areas. So we're really highlighting a lot. I think it's all how it's framed. And school is really the place that can set that framework up early on to normalize the fact that there's lots of adults who are looking out and teaching these skills. They're teaching the importance of a mindset that's ultimately going to help your child be successful if their mindset is one of, I can do it, I'm just not there yet. So I think it starts really early on to kind of lay the foundation of normalizing talking about it and how that's problem solving and how it's going to ultimately help remove obstacles in their way that are inevitable in life, because they're going to be able to think their way around it and overcome any of those hurdles. So I think that's one of the biggest things. Two, as a therapist, and those people have kind of referred to me almost as a teacher. There's a high regard for people who help you and educate you. And I think when the grandparents have come, that's maybe how it has been framed to the grandparents, where they're taking their grandchild is, this is someone who's coaching them in something. And, as a therapist, it doesn't matter to me what they think about how I do it. If I'm a teacher, if I'm a therapist, I'm still doing the same work. And my goal is to help the child function better in general. So anything that I can do to help support that and to help kind of, remove that stigma and show the positives and the positive changes that are happening, that's really what's going to change the mindset in general. So maybe even helping to highlight some of the areas that we want to see that shift in a child's attitude towards something might also be helping to remove some of that stigma as well.
I think those are great points, because I see two examples, sports psychology, sometimes these athletes, they're already good enough, but sometimes it's take that support coaching from a psychologist for them to win that gold or whatever. And on the business side, lately, here in Hong Kong, I've seen a growth, and I know I've seen it in the US, is just the coaching for executives or for professional coaching. That area has grown tremendously. So you're right. I think kids also need that coaching in terms of dealing with your mind. So addressed in that way, I think it's probably less of a stigma. But I think overall, I think mind and body, I think, and lately we're also hearing a lot about mindfulness, and but it is something that the mind is also something to be addressed if there is any issue, rather than waiting till it kind of blows up. So I think those are great points. Here, this question comes from audience asking, what organizations in Hong Kong can I go to for services and support for my child mental health?
Well, there's lots of different organizations. If you're talking about, therapy, there's lots of really great clinics that focus on children and adolescents, and they treat a variety of psychological disorders and kind of things that need to be worked on and addressed. And then there's also some NGOs out there too that are really helpful and offer free services. The Zubin Foundation is one that offers for refugees and other people kind of lower income who need discounted or free services. They also offer some adult services as well. The Kelly support group has a bunch of groups and different things there. They're wonderful, and I think they're great advocates. And what they do is they pull in counselors and clinicians from all over Hong Kong to kind of build a greater network, which I think is a great thing to do. If you are in great need, social welfare can be really helpful. They do have really well-trained people there. And they can point you in the right direction to giving you places that can offer services, especially for the local community where they're able to access care in Cantonese. I think that can be really helpful. So it's a matter of just kind of doing a search and finding it. There's lots of places available. There's even places in different parts of Hong Kong that even I'm unaware of, but I'm always surprised there's different things that are popping up. I think one of the most important things to realize, though, is when your child is going, especially the younger ones, when they're going to therapy, all therapy is based in play with kids. It's, I think parents get drawn to the idea of play therapy because they're like, oh, that's what they should do. Any therapy with a child is going to have an aspect of play to it. It just depends what your goal is in terms of how are you working on their cognitions and changing the way they think? Are you working on addressing behavior? Do you want to do it in more of a family context? Do you want to do it in a more non-directive way? So you're interpreting a bit more. I think that's the biggest thing. And that's one of the common misconceptions for families is they don't know exactly what they're looking for to be helpful. And, my take on that is you should go for the thing that has the best evidence of having the greatest impact. It's almost like, would you give a vitamin that you're not sure isn't going to work, or would you look for the one that has the best results? And they can do some research online for that to really see what would be the most helpful for certain things. In general, talking to someone about anything can be helpful. They've shown positive effects of even untrained therapists working with people of having some sort of positive effect. But for kids in particular with certain difficulties, definitely find what's going to work. And if it's not working, go do something else. That's the thing. You're not stuck in that same routine. It's again, that tutor mentality. If one tutor isn't helping you get the higher marks, you can hire someone else. And that's okay too. You shouldn't be put off by it. It's just, it wasn't a good fit. The most effective thing a therapist can be for a family, the most effective ones have the greatest rapport with the kids and with the parents. That should really be what's important for you to be looking for if you're seeking support, is establishing rapport and trust.
Great. Last question. This one says, if I would like to arrange to have some professional to talk to my 10-year-old who is going to international school who also might have ADHD, could you give some recommendation on who to go to? This is a specific question, but you work with ADHD. So, and that's an area that, again, a growing field. But what is your advice to parents here in Hong Kong with kids that might have ADHD?
So I think with ADHD, it's we're looking really for history is one of the biggest things. ADHD doesn't just pop up. You usually see, it's even in hindsight, like, oh, they were very active toddlers. They've always kind of had trouble sitting still. They've had a higher need for activity. They've had a decreased need for sleep. They kind of put their foot in their mouth a lot of times because they're very impulsive. So we typically see a pattern that's been there. I will say in Hong Kong, we have a lot of really bright kids here, and intelligence is something that, helps you cope if you have ADHD for a long time until it starts to impact relationships. And the thing with ADHD is many of these kids can't get out of their own way because they don't realize that they're off-putting or that they're being impulsive or that they're, we call it space invaders, when they're unaware that they're encroaching other people's space or they're interrupting. So I think noticing when it's starting to impact them overall and they're starting to have a negative view of themselves for things that are out of their control, that's really when it's a time to intervene. When you're noticing it's impacting their ability to sit and actually learn, and they're starting to feel bad about themselves when it's out of their control. What you often want to do is you want to get some clarity about is it really ADHD or is it something else? Because sometimes kids who are anxious can be off task, they can be daydreaming, they can be having trouble socializing, they can be dysregulated and crying over seemingly nothing. And it's not always, I'm afraid, but that it can be stress. So I think it's getting clarity about what is going on with your kid, and how you can do that is by going to a professional who is going to talk to the parent, talk to the child, ideally, do some sort of testing or measures to compare your ratings of behavior to a normative group of how the child is compared to that. It's normal to be off task. It's normal to sometimes be a little hyper. But is it too much is really what the determining factor is. And then once you have that clarity, then you can start doing some work on it and work on specific areas. So the executive functioning part of the brain is the last part to develop. Therefore, kids with ADHD, it's even more hindered by their ADHD. So we really have to be specific in how we improve in those areas. And it's usually in a very stepwise way. You can't just say be more organized or follow 3-step instructions. You have to slowly build up and build kind of their competency in those areas and start to teach them how to see the value in those routines, because it's hard for them. And when your mind thinks really quickly, to have to slow down is really challenging for kids. So if you think about a bright kid in math, how you get points in math class is by being able to solve the problem in a stepwise fashion and show your thinking. An ADHD kid who's really good in math will just get the answer, and they don't see the point in going back because they're done. They can't go back. So that's how it starts to hinder their grades. It's because they're having difficulty going back and doing that. So what we need them to do is approach a problem and slowly start to break down their thinking before they get to that answer, to then catch any careless mistakes they might make as well. Because the thing is, when you think fast, you're more likely to make a mistake because you're not checking it. You're not being careful with your steps. So it's really figuring out what areas your child needs to work on and then finding the right person to do that. Sometimes it could be in a group, which I think can be really helpful for kids with ADHD. And it doesn't just have to be kids with ADHD. It can be a mix because that's more of what a general classroom is. Sometimes it might be one-on-one. Sometimes it might be working with the parents, with the child. So it really depends what is going on with your kid and what age they are. There's a lot of different really good treatments for kids with ADHD that we know can be really helpful. That being said, also we know that medication is the most helpful. And there is a period of time where kids are more open to taking it. And then there's a period of time, usually 10 to 12, 13, when kids all of a sudden don't want to start taking it anymore. So that can be a trickier age to start because there's more resistance because they don't want to be different. And by telling them that they need something like that, you're making them feel like there's something wrong with them, which is the last thing we want them to feel like. So again, it's how we explain it to our kids, how we help them understand the brain, and then it's how we help them develop in those areas. But first, the thing you need to do is make sure that that is actually what's going on, because we want to be accurate. So then we can figure out what the most effective treatment will be to support your child.
So now I know we're kind of running out of time, but in because your background in this area, and I'm also this may be kind of a general question, a too broad a question, but I'm just curious. In time of COVID, this last 2.5 year, the impact on special needs children, is the technology good or bad? I mean, and I've had friends who kids who are on the spectrum. How can parents also, or again, teachers help kids with special needs during this? I'm sure it's also traumatic and very difficult for them as well. How have you seen that that group of special need children?
I think they're the ones who've actually probably suffered the most because they aren't able to connect the same way on Zoom for learning and being able to connect the same way with peers. You know, they benefit so much from either being mainstreamed or being in environments where they get to see other kids, where they get to be out and playing with them, even if they have a shadow, like a person who's hired to be there to support them. It's still giving them lots of opportunity. So those are the kids who really, I think, have probably had the worst outcomes because they don't understand why they're not able to. And they have, some of them have some difficulty learning also. And without direct instruction with someone there to support them, sitting next to them and slowly skill building, there's wider gaps that probably weren't as severe before. They were kind of keeping their pace. They might have been behind, but they were still building. And the gaps are widening. So I would say it's one, getting them out as much as possible and around other kids, just to kind of give them those interactions, give them the chance to observe others, to see others. But two, it's also in a positive way, trying to continue to kind of work on the learning of them for them in terms of what they should be trying to acquire. Like, I think that's probably one of the greatest concerns is, you know, how are we ever going to make up some of that ground that was lost during this? And especially for the kids with learning difficulties, you know, they don't rebound as quickly when they get back to school as kids who don't have those issues. So, you know, and that affects the way they think, it affects the way they feel, it affects their self-esteem. So it's a terrible vicious cycle. So as much as you can build up in those areas slowly and in a positive way, so that they continue to make progress, even if it's during the summer, just a little bit consistently, or maybe it's doing something, you know, online with a remote teacher who will be kind of going over strategies and things. Those are all things that can be really helpful, so that we don't lose as much ground again, like we have over the past few years.
Great. I think what I want us to do now is wrap up, and I want to give you an opportunity to talk about, what have you seen? You mentioned, I think, in one of the interview about resiliency, kids, and so on. As a parent, and also seeing in your own kids, although you're not in Hong Kong right now, you're still taking patients, as I understand. You're talking to your patients here in Hong Kong. So again, technology has really enabled. That's the plus side of it, I guess, and we can also bring you programs like this. But talk about kind of the what are you observing in your own kids, in their how they have adjusted in this, some of the transition, the moves, and so on and so forth. And you're coming back, which I'm happy to hear. So well, we need, because I'm so. One of the things, if I'm depressed about, is really some of the exits. A lot of friends are leaving, or families, and some of them, you said Hong Kong's a transient place; people come and go anyway. But I'm also seeing, migrations. I mean, I have some young colleagues who are getting their new starts outside of Hong Kong in over the summer. So it's been kind of depressing as an adult. So how do you kind of in your children have observed, and how have you been kind of adjusting to this time of this ups and down? And it's not over yet. I mean, we still, who knows how long we still have for this COVID to continue. But how do you advise? I mean, taking care of yourself is something that you've always mentioned, but your observation, your closing thoughts on maybe on resiliency.
I think, knowing that, this too shall pass, I think is a big one, that kind of that you're going to be able to get through this, and really reflecting on how much you've already been through. Before coming here, I decided to enroll my kids for a few months into school, and I was petitioning to get them into a district, and I had to write a letter about why they should go. And I just outlined what we had been through in Hong Kong the past 2 years. And I read it and I was like, this sounds insane. I was like, and it's real. I didn't even embellish. So, even, being able to laugh at what we've been through, and actually, even when we reflect back on how, we were in this gilded cage of being in Hong Kong and not able to leave, we could still say we were so lucky we got to be able to take a boat ride, or we were able to go to the beach, or like, it's really focusing on how we were able to find things that still nurtured us and fed us, and appreciating those moments. And I think trying to model that for our kids, and trying to even focus on that with your own children, and trying to get my children to pick something that was the highlight of the day. So I do a lot of, in therapy, sunny and cloudy thoughts. Tell me the cloudy thought of the day and tell me the sunny thought. And what I work on for the cloudy is, okay, now tell me the silver lining of that cloud. And the reason I like to do that is it's okay to have something that you didn't really like, but what was the good that came out of it? What did you learn? Was it that you could get through it, that it was over, that it wasn't as bad as that you thought, that, oh, a friend did show up, so it made it better? Helping them not get stuck. So I think that's probably one of the biggest things for resilience, is to be able to know that you're going to come out on the other side of it. And, and to also know things aren't always going to go your way, but do you get up again? Yes. Do you keep trying? Yes. And what is your attitude towards trying? Should it be one of falling apart, or should it be one of, I always get there in the end? It just might take some more practice. So in therapy, we love to use the word yet. I'm an anxiety specialist. So a lot of what we talk about is being brave and building your brave muscles. And again, you're just not there yet. How do you build those brave muscles? With lots of practice, putting yourself in the situation that was hard and then being able to overcome it. So really focusing on that piece, I think, is the biggest thing. And I think even for us, thinking about our friends leaving, we're grown-ups. We know friends are important. We're going to figure out ways to make new friends, be it we take up a new hobby, or we see someone and we extend, an invitation to them, or we even say hello to them and start a conversation. I think there's a lot of opportunities here for us to kind of get out of our own comfort zones that we were in Hong Kong, because there's still wonderful people there. There's lots of friendships to be made. There's new circles to kind of join, and really helping our kids to do that too. This is a good time to try a new activity. This is a good time to, sometimes our kids don't want to do things because it feels like it might be hard. Just getting them signed up to give it a go, even if they don't like it, it's something that they tried that was new. Even if it was a total bomb, they went. And that's what you focus on, not how well they did at it, not did they excel at it, but did they give it a go? And I think that's really that, in general, if we can focus on that we're trying and that we're continually trying, that's where the growth is really going to come from.
Well, that is a wonderful thought to end on. I think what you said is also great advice for adults, and try things you never. And I have to say, in this last 2.5 years, I've tried things I never thought I would do, and there has been a lot of pluses that has come out of it. And so, for my own closing thoughts, and I said this to my colleagues at a talk recently, 2 words that I've learned to use quite a bit these last year or two is gratitude and resilience. Gratitude for what we have. I mean, things are not perfect, but I've been able, with this program, talk to so many interesting experts from all over the world about an issue that we're still grappling with, and we're going to continue that. And in fact, we have our next episode is going to be a repeat visitor, Dr. Ivan Hong, who has been doing some interesting work on a vaccine that is going to be dealing with Omicron specific vaccine that Hong Kong we here in Hong Kong, we do have some wonderful specialists, infectious disease specialists. And this is one of the reasons we started the program, was to look at the solutions. Not everything, if there's a problem, I think we have experts to help us solve it. and sometimes it's going to be a process. It's not overnight, and so we're going to continue these type of talks. And again, want to thank Melissa. Thank you for taking time from your schedule to speak with us. And those of you who are watching out there, I really do take care of yourself. I think there's certain things I think it's beyond our control, but there are certain things that we can do something about it. And if it's taking care of talking to your kids, talking to your parents, I think many of us have gone through loss this last year, and there are ways we do need help. Just speaking to friends and professionals can help us. Really, it's very appropriate. You talked about the cloudy thoughts. We're here in Hong Kong now with torrential rain, amber rain warning. But one of the things when the rain is over, there is light at the sun does come out, and the song Tomorrow. The song from Annie, there's always tomorrow. And so those are positive thoughts I want to kind of end on. And again, thank Melissa for taking time with us, and really wish all of you health and including good mental health, and tune in for our next episode with Professor Ivan Hong. And take care, and